Good morning, everyone. Lovely to see you all. My name's Jen Logan. I'm a mental health programme manager at South Central and West Commissioning Support Unit.
And I'm Rebecca Hodge. I'm the Clinical Services Programme Lead for Mental Health at SCW.
So today we're going to talk to you a little bit about a couple of case studies. However, just to give you a bit of a summary about our team. So Rebecca and I are part of a wider mental health team at South Central and West. Between us, we've got around 60 years of working in mental health and the public sector. A variety of backgrounds: registered mental health clinician, psychology, governance, commissioning, project management and data analytics. These are just a couple of our solutions that we work through, so particularly some of the case studies that we'll talk about today will draw out some of these key themes. But just to give you a flavour of the work that we do, we work at national, regional and at place level as well.
Great. And as a team, we work across all ages of mental health services. However, today we're going to focus on some of the work that we've done around children and young people's mental health. And that's particularly because, as we know, there's a massive rise in children and young people's mental health problems at the moment. So it felt quite pertinent to talk about some of the work that we're doing in this area. So the first piece of work that we're going to talk about is some work that we did with the Frimley ICS around their children and young people's mental health crisis pathway. And I'm going to show a video next from Nadia Barakat, who's the Director of Mental Health Commissioning at Frimley CCG. We're hoping you're going to be able to hear it. Let's see how it goes.
Hi everyone, my name is Nadia Barakat. I'm the Director of Mental Health, Learning Disabilities and Children and Young People for Frimley CCG, soon to be Frimley Health and Care ICB. And I'm here to talk about some of the work that Frimley and the CSU have been doing together around children and young people's mental health. So we have a very complex landscape in Frimley when it comes to providing and commissioning actually children's mental health services. And we've had some particular challenges, unlike not dissimilar to other areas in the country, around children's crisis services, particularly children ending up in our acute hospitals and really getting stuck because the way in which we've got our services commissioned and delivered has been a combination and a jigsaw puzzle of provision. So we have, back in probably a year ago, June 2021, we started as a CCG and the ICS a children and young people's discharge meeting focused around our 2 acute sites. I'm really trying to unpick and unblock any challenges with our children who were being admitted or ending up in ED and then being admitted and then getting stuck in our acute hospitals. And from that work, we identified that there were some really different ways in which crisis services were being provided across both our sites, historically arranged and commissioned. We've got, as I said, we've got a very complex landscape with 3 children and young people's mental health providers and a mix of commissioning arrangements which have been historical. And so what we wanted to really understand was what was really going on. And we had some assumptions on which we were working, but we really needed some dedicated focus work around what was going on, what was the pathway like and the journey like for our children and our families when they were ending up in acute settings, and what we could do to try and make that better. So there were some real pressures, immediate pressures in our our kind of urgent and emergency care pathway. And that's why we decided to look at bringing in the CSU to do this crisis review. And they worked really seamlessly with us. The team were flexible, approachable, very dynamic, kind of heard what our challenges were and developed a brief with us to really hone in on what we wanted to get out of it. They worked to our timescales. They delivered a project plan, which then kind of quite quickly transformed into a delivery. We set a very challenging timescale of about 8 weeks, 8 to 10 weeks, I think it was, for the team to really do this work, really focusing on one of our acute sites because that's where we saw the pressure, but then moving on to our second acute site. So within probably about 12 weeks, probably 8 to 12 weeks, we got a finalised report. So they did some really swift engagement, both with our acute colleagues, our mental health providers, parents, children, and staff within wards and ED departments to really understand what was going on, did some patient note reviews, and really take a holistic view around what was happening for that one person and that one family. What it really showed was some of it was about confirming some of our assumptions, but it also pulled out some real key recommendations about things that we could do to improve almost immediately some of the experience. And they were quite wide-ranging recommendations, which we've brought together a stakeholder group together to talk through. So I should mention that actually there was quite a lot of engagement with not just frontline services, but also commissioning partners. So because this work spanned across both, not just Frimley, but also Hampshire and the Isle of Wight and Surrey Heartlands, this was very much a kind of pan-ICS piece of work. So it's really what I think it has done is it's that not only has it provided some real clear recommendations about what we need to be doing in sort of short and long term, but it's also really raised the profile of the challenges and the need to do something quite quickly for those children, young people and those families to really make their experiences and ultimately the outcome for those children much better. So it's really done a few different things in terms of the impact of that review.
Thank you. So hopefully everybody could hear that. Just a little bit more detail about what we did. So developing this understanding of the issues around the children and young people's mental health crisis pathway, particularly focused around the two acute hospitals, Wexham Park Hospital and Frimley Park Hospital. We used a mixed methods approach, so we carried out quite extensive engagement. And when we talk about frontline clinicians here, we're talking about general trained staff, so adult nurses, paediatric nurses working within the acute hospitals. We used an appreciative inquiry approach, so understanding what works well now, but what could be better, what could be improved. We carried out a review of clinical case notes, and we mapped out the services available to children and young people for children and young people's mental health and wellbeing services across the 3 different areas. We carried out a rapid evidence review around models of mental health and crisis care for children and young people, and also looked at the role of the parenting support worker, which was something that came out as having been a useful role to implement within the crisis pathway within Berkshire Health. Fortunately, not a great deal of robust evidence out there, as I'm sure you can understand. We carried out a thematic review of all of the engagement, as well as what we'd learned from the case note review, and we triangulated that with some of the activity data that we had, and also what the evidence was telling us. So our final findings were the themes that came out of this, so a rise in acuity of mental health problems in children and young people, and also capacity within the wider children and young people's health and wellbeing systems, so schools and other areas, being able to manage risk and support children and young people, and the impact that then has on people, children and young people presenting at the acute hospitals. Particularly around Frimley Park, they had a paediatric mental health liaison service that as things have progressed, it isn't quite fit for purpose at the moment. So that, we also looked at the ward environment, so a theme came out around the ward environment not being an appropriate place for children and young people when they are in mental health crisis, and the impact that has on those general staff, on those frontline staff, caring for children and young people that they haven't had the training to support. And also what works well, so actually generally there was a feeling that the issues were with the system, but individual clinicians and individual professionals that families and children and young people were coming into contact were actually quite positive experiences, so it's a wider system issue. Further themes, so there was a general acknowledgement that A&E isn't the right service to go to when you're in a mental health crisis. Obviously, if you do have a physical need, then that is the right place. But quite often families are feeling stuck and not knowing where else to go, and you know that you can get seen by somebody if you go to the acute hospital. And this feeds into the gaps in service that we're all very familiar with across children and young people's mental health services. Another theme that came out and comes out quite heavily in the literature as well is that children and young people's mental health and wellbeing systems are really complex to navigate, and I think you'll hear that from anybody that has access to these services. It is challenging, and there is a lot of variation, and they change quite often. And that's particularly pronounced within the Frimley ICS because of the complexities around their commissioning landscape. And you end up with a little bit of a postcode lottery. So if somebody comes into the acute hospital, you might have a different service depending on where you live. Having to tell your story more than once, this is a really common theme that comes out in any piece of work around children and young people's mental health. I think the NHS Youth Forum mentioned it in some of their research yesterday. So seeing lots of different clinicians or professionals, and each time having to tell your story from the beginning again. And that ties in with feeling that children and young people's needs are not understood or valued. And another theme that came out was around support for parents. So parents feeling really isolated and not really knowing where to turn to. And then, as I mentioned, those parenting support workers roles that have the potential to actually be really valuable. So our recommendations were a full review of the crisis pathway, particularly around Frimley Park Hospital, where these complexities are most pronounced. For the ICS to consider a centralised hub for children and young people to support them, and also the professionals in trying to find and access the right services. For frontline staff to be offered specific training in mental health. So actually, how do you support these children and young people when they're on your ward? And better, more accessible support for parents, and a review of the quality of record keeping, which ties in actually with a new patient record system that they're bringing in across the acute trust anyway. So the next steps, this feels very much like the first piece of work in this pathway that we're doing. We're now supporting the ICS with the redesign of the paediatric mental health liaison service, and we're working with workforce colleagues on that to look at actually what is needed to meet the demand, to meet the needs of the children and young people and the families that are presenting at the acute hospitals, and how does that interface with those complex services that they need to discharge out into at times. Within that, we're looking at a care navigation role, and that ties in with supporting navigating those really complex systems, but also support for parents. We're taking learning from primary care where that type of role has been useful, and looking at how that can be transferred. Something that's been implemented by the acute trust is mental health training, and that's being offered to frontline clinicians. Pretty much every frontline clinician we spoke to asked for additional training in mental health. And not something that we're so involved with, but the report has also been used by Bernardo's as the basis for an in-reach model for children and young people on paediatric wards, so it's being used for that as well, which is really positive to see those kind of wider ranging of impacts and action being taken. Thank you. So I will hand over to Jen.
So today I'm just going to be giving a quick overview for CREST. So CREST is the Children and Young People's Referral Management System tool, which is a bit of a mouthful, so it's known as CREST. So it's a demand and capacity tool for CYP mental health pathways. It's basically a strategic tool that can support your local intelligence, and it's been used in successful business cases, thinking about new services, what they could look like and what capacity is needed to meet the needs of the population. Quick summary of CREST. So there have been various iterations of CREST over the last few years. So we've been working in partnership with the National CYP Mental Health Team. They've commissioned us again for 2022-23 to do some further developments of the tool. But if you logged onto the CREST website, what you would see is the version that launched in March 2020, and that was just before the COVID pandemic. So yes, this year I'll come on to some developments that we're doing shortly, but it's great because the last couple of years we've been doing kind of tweaks, modifications, refining different bits of it, and that's all based on active user feedback as well, which we're really proud about. So how does CREST work? Front up caveat, I am not a mathematician. However, Erlang is based on the principles of queuing theory. Queuing theory is actually, it's around the waiting times. So Erlang is used in call centres, for example, telephone exchanges. However, for the purpose of this, it can also be applied to healthcare settings, and that's what CREST is based upon. CREST can support transformation in a variety of ways. As I've mentioned, it can support your strategic planning, operational planning also, but it can also inform decision making at system level. So it can help with a couple of key questions when you're thinking about your demand and capacity and how to, again, to meet those needs of your CYP population. We do just have a short demo, so before I lead over to Nessa, this year is all about increasing the functionality for the tool at ICS level. So we've had some feedback about what's going to make it better for users, and then that's kind of the main goal for this year. So part of it is about doing a bit of a relaunch to making sure that ICS colleagues actually know what the tool is and how to use the tool.
I'm going to be showing a demo of the current early stage developments to CREST and the planned future developments in the 2022-23 financial year. The demand and capacity modelling tool will be hosted on a web app and accessed through the pre-existing website. When users open the tool, they will see a data upload page. The new developments have focused on increasing the ease for users to model multiple services at the same time and utilises a simple CSV data file. There are options to download a template to be populated, and information is provided on the expected definitions of each of the columns. Once the template has been completed, the user can upload the document with their chosen number of services for modelling. Before proceeding, there is the opportunity to sense check that the file uploaded is as expected. This simple annual information then provides the required data to complete the first option for modelling, looking at the required weekly appointments to meet demand within the input performance targets. As we move on to the modelling page, there's a drop-down allowing the user to select which service they wish to look at, as well as alter a number of different variables to consider different scenarios. The chart to the right considers the number of breaches beyond the target wait time for different numbers of weekly appointments, as well as the utilisation percentage for those appointments. There's a data table below providing all the data, as well as a modelled average wait for patients before accessing the service. By manipulating the variables to the left, we're able to test out different scenarios. For example, in this dummy service, the required number of weekly appointments to meet the performance targets is 819. However, if the acuity of patients increases, causing an increase to the average number of contacts per patient, we're able to see that the required number of available appointments to meet those performance targets is now 1,024, a significant increase. The modelling on this page provides a view of an average week for each service with very few inputs. Additionally, there will be a second option for modelling within the new tool. This will require optional columns within the data upload are completed, showing total referrals by month over the latest 12-month period. This additional data will provide the option to consider a 12-month forward view, modelling seasonality, growth trends, and potential emerging backlogs between the number of required and available weekly appointments. Similarly to the modelling shown on screen, users will be able to interact with the variables, allowing them to consider what-if scenarios, such as, what if the available number of appointments for this service decreases? What if referrals continue to follow the trend of the last 12 months? And what if referrals over the next 12 months increase by 20%? These and more can be considered using CREST. Finally, we know how important it is that the user not only accesses the modelling, but can share it with stakeholders and decision makers. While CREST will not hold any uploaded data once the user closes the web page, there will be the option to take away downloads of the charts with summaries of the modelled scenario. In further developments, there will be the option to download customisable management reports in a PDF or presentation format to share. I hope this gives you a good insight into the developments of CREST demand and capacity modelling tool over this financial year. If you have any questions or comments, please do get in touch with the team at the email address provided.
So as Ness has just been describing, the additional functionality is going to, you're able to do multiple pathway uploads. However, what we're most excited about is the scenarios and the 12-month forward view, and we feel like that's going to be really beneficial to the people who are using it. This is a subtle plug. We are about to come into user acceptance testing over the next couple of months, so if anybody would like to be involved, please do let us know, because we're really keen to make sure that this fits the purpose. What was really interesting, sorry, I just lost my train of thought. We met with some colleagues and were doing a demo earlier in a system in the southeast, and they were CAMS leads and neurodevelopmental leads, and they were asking really kind of interesting questions that Nessa herself said, from an analyst point of view, hadn't considered. So what we're really keen to do, as I've said, is to make sure that this is going to be fit for purpose for the people actually using it, not us kind of on the back seats of it. What was really interesting as well was there was the question around complex pathways and what does that mean. So for example, the ADHD pathway isn't linear. So when you're thinking about demand and capacity modelling, what does that mean? Like modelling individual sections of the pathway. So it gave us food for thought as a project team, and then what we were thinking is we could do kind of a short-term fix, and then in the second half of this year to refine that, again, just to make sure that it really is useful for people using it at ICS level. And I think that's it. So any questions for Rebecca or I? Oh, yeah. Oh, should I give my mic?
Hi, thanks so much. The basic principles of the backlog management and demand capacity, Erlang, seem as applicable anywhere else as they are in CYP. So what's the roadmap for this in other areas?
So this tool is actually commissioned for CYP mental health pathways by the National CYP mental health team. So it is freely available, and we've actually had queries from colleagues in different systems for different pathways, for example, cancer. However, part of our work is just we're making sure it's usable at CYP mental health pathway level.
Any other questions?
No. Thank you very much.